Good afternoon, everyone. Welcome. Welcome to our discussion today. Um, Skin Deep, a conversation on skin conditions in the Black community, where we will be talking about common skin conditions that disproportionately affect the Black community, along with myths and misconceptions about skincare and treatment. It should be a really exciting discussion, so thank you so much for joining us. My name is Dr. Camille Campbell, and I am the Senior Director of Health Equity here at Now Included, powered by Acclinate. And I will be joined by a couple of other amazing guests. We have Dr. Desai, a very experienced dermatologist who will be sharing his knowledge with us and his insights, as well as Ms. Telisha Harrison, who also joins us from the Now Included Powered by Acclinate community. And so before we jump into the conversation, Dr. Desai and Telisha, if you guys could just take a couple of minutes to introduce yourselves so that our audience knows who's on the line.
Telisha, you go first. Beauty before beast. So go ahead.
Sounds good to me. Hello, everyone. I am Telisha Harrison. I am a clinical research specialist at Now Included, powered by Acclinate. Really excited to be here to uplift community and increase awareness about skin conditions and things that affect us, so that we can make those the best health decisions we can.
Hi, I'm Alpesh Desai, and I'm a board certified dermatologist in Houston, Texas. And I focus on general dermatology, medical dermatology, surgical dermatology, cosmetics. I kind of do it all in the dermatology realm. But what my true passion really is about advocacy. And I have multiple clinics, and that's one of the things that I try to teach the other providers and other doctors and mid levels about really being a good advocate for your patient. And I am just so happy that we're doing this because it's kind of by chance that this all kind of came to be. But I'm very, very grateful to Now include it because I've been kind of raising my hand, yelling, screaming, "Hey, look, let's do something like this!" And it's finally occurred, and I'm really, really grateful to be a part of it.
Awesome. Well, we are super excited to have you here. And we'll jump right into the conversation, starting off with you, Dr. Desai, and asking why. I mean, you said you've been raising your hand, wanting us to do something like this. So tell us from your perspective, why is it important for us to talk about skin conditions in the Black community?
Yeah, no, I think it's a very good question. What's interesting is that in the dermatology field, SOC or skin of color has become a buzzword, and it's just been very recent. And when I say recent, I mean last couple of years. I mean, we're in 2025, and we're just now talking about skin of color. And I guess growing up, I didn't know I was going to be a dermatologist or anything like that, but through all of us, I mean, through our childhood experiences, our adolescence, or college days, what the one thing I noticed, because my dad, he's retired now, but he was a nuclear engineer, and because of his job we moved around a lot. And when you're a kid, you kind of like you can't really maybe sometimes quantify it or put something to it, but like that's not right. And moving in these different communities, and usually they're underserved areas because that's where they're going to build a power plant. You kind of see I saw it firsthand. And then later on, when I actually went through medical school and went through post medical school training, you look back and you're like, you know what, that would there was an inequality of treatment, so that just kind of furthered the fuel or the fire. And so why is it important? It's important because no one's talking about it. And if we are talking about it, it's like it's very superficial. So we got to, when you're treating a patient's skin of color here, let's say African American individual, it's not just about their skin. It's about the culture, about their background, what they've been through. And I'm probably jumping the gun here, but so yes, it's important because no one's talking about it's a big elephant in the room in dermatology. So
Awesome. Thank you for that perspective. So, what I'm hearing is it's important because the conversation needs to be raised to the attention of dermatologists, but also because there are certain nuances from a cultural and community perspective that folks need to be aware of when addressing skin conditions, whether they're a healthcare provider or a patient or a caregiver.
Right. Well, like, and I talk a lot, so just please tell me to shut up. But
It's okay.
I get really. So I'll give you a quick, simple example. Growing up, I had inflammatory acne. I still have a little bit of scarring, and so what my poor parents, they took me to the we drove like 2 hours, and the dermatologist came in, he like flung some benzoyl peroxide at us, and we try to catch it, and we go home, and then my parents yelled at me because the benzoyl peroxide ended up bleaching the sheets. Okay. What I'm getting out of the story is not that my parents are strict. They are, but the important part about this is that benzoyl peroxide is a very, very subpar acne medication. And the studies that they did with benzoyl peroxide was on Caucasian skin. Benzoyl peroxide on my parents are from India, for African Americans, Indians, Middle Easterns, Hispanics, Latin community. It's actually an irritant. Okay, and now. And I've always thought that I have. You can look at my prescribing habits. I never write benzoyl peroxide on skin of color. I never have, because it never worked on me. And so that's just a really small. And how many people in the United States or in the world have acne, and we're just throwing benzoyl peroxide.
Mm-hmm.
And now finally I got my redemption, because benzoyl peroxide, there's some talk about it being carcinogenic. So they've pulled benzoyl peroxide off the market in a lot of these medications. So we do better with certain like alpha hydroxy acids or things of that nature. Benzoyl peroxide on skin of color patients, especially African Americans, is it's a recipe for disaster. So anyway.
And we'll probably talk about this a bit later, but also I bet there were no people of color
Right.
in those clinical trials
Right.
that got benzoyl peroxide approved for those different indications like inflammatory acne. So, how would you know that it's an irritant until it's being used in the real world by a very diverse population?
And that's a great point. And Dr. Kim, that's why you're the director. So that's a very, very, very good insight there. So.
Telisha, and thank you for sharing that personal story, Dr. Desai. We appreciate that. Talisha, I want to hear from you from a community member's perspective and from the perspective of someone who leads our community, now included community. What are your thoughts on why it's important for us to talk about skin conditions in Black patients?
Thanks. Yeah, and first I want to say I'm really excited as well to be having this webinar. Dr. Desai have been trying to put something together for quite a while, and I'm really excited that it's happening now. But from my perspective, and from the Black community, I think it's important to talk about all health issues, skin conditions, most importantly, because in addition to what Dr. Desai mentioned, if we look at the history of this country and the role that racism plays in the health inequities that we see, is based on skin color, right? So, there's already a challenge for the Black community to feel valued and honored within the society. And then you want to add to that, these, health conditions, it just raises the bar or exacerbates the situation. And so, it's something that we definitely need to talk about so that we are able to empower people to advocate for themselves when they go to the doctor. And I want to share a brief story as well. It's not about a skin condition, but a couple years ago, my daughter is 12 now, but when she was 9, she was hospitalized for a week. And during that time, she could not walk. She was experiencing very intense back pain. And the whole time we were there, it was a huge fight to get them to, provide adequate care. Now, I'm in the healthcare system. I knew what terms to use, right? I had some connections within the health system. But the whole time I kept wondering, what do people do if they don't have that, right? And so again, for me, a lot of the reason why I'm here and really want to provide this type of information is so that when people do run up against these systems, they have adequate knowledge and understanding to advocate for themselves and get the best care that they need.
Thank you, Telisha. And thank you for putting that societal perspective on it as well, because, again, a lot of the structural challenges that we experience as Black people is because of our skin color that we're born with and can't change. And then when you add something on top of that, like a health condition, it just makes it amplified and magnified even more of the disparities. So appreciate that. And thank you for sharing the story about you and your daughter. All right. So moving along, let's talk about some of the common skin conditions that disproportionately affect Black people. Dr. Desai, can you share with us some of the ones we should know about? And I think we may have some slides here to help facilitate that part of the
This
conversation.
is my favorite part. This is why I wake up early in the morning and get to work. I love this stuff. And again, I want to make kind of a blanket statement that I believe that all skin conditions in the African American community are not treated properly. Okay, I think it's a widespread systemic issue. However, we don't have hours and hours on end, and if the viewing or listening audience really finds this to be powerful or educational or just helpful, then we can do more of these, and even the kind of shorter segments, so that so that we can cover some different conditions. But today, I really think that we should concentrate on prurigo nodularis, atopic dermatitis, and hidradenitis suppurativa, and those are some long words, and we'll get to what they are, and I think those are if I had to pick 3 or 4 or 5 conditions, these are the ones that are just widely misdiagnosed or undertreated. For instance, if we I'm not sure which one we're talking about first, but for atopic dermatitis, it's known as eczema, and I mean, a lot of people think it's just dry skin or itchy skin, and it's so much more than that. It's actually a complex, chronic immune-mediated condition, and I think that a lot of us, including doctors, don't know that. But I remember, again, one of these childhood stories. I remember one of my very good friends. She was this African American gal. We were maybe in 6th grade or 5th grade. Liza Edison, I still remember her, and she was so smart. I mean, incredibly smart. In fact, I used to try to, peek over her shoulder in math and spelling. And I mean, just a brilliant young lady. And we became pretty good friends. But what was happening, and you could see that she, now that I have the knowledge, she suffered from severe atopic dermatitis. And her skin was lichenified, which means it was kind of like leathery, she had open sores from the scratching. And she would miss school quite a bit because she didn't get the enough sleep, or she was up all night scratching, and her parents took her. I mean, they had a nice family, took her to the dermatologist. Really didn't do anything, And guess what? I mean, then we all went from 6th grade or 5th grade to middle school. I mean, I think she dropped out of high school, and I've not And look, I'm sure there were some other factors, but she was a brilliant young lady, and look where and because she was improperly treated, it led to probably so many different things, So that's the power of being an astute physician for skin of color, for African Americans, because again, you're not just changing the trajectory of a person's skin, you're changing the trajectory of their life. Okay. So, I have some young kids, and, my daughter's a little bit older, studying for SAT or, college out. If she's itching and not able to sleep, I mean, how is she going to perform? I don't care how smart. I mean, sleep is paramount, So, or their skin, like Miss, my friend, she had that lichenification. I'm sure she got, bullied, and there's all sorts of things that can occur. So that's why we have to understand African American skin, and we have to treat it properly and adequately. So throwing some benzoyl peroxide or some cream at it and walking out the door, much like, in a way, how Telisha and her daughter were unfortunately treated, is all, we got to change that. So.
Thanks, Dr. Desai. So you talked a bit. I do want to go back
Yes.
in a second to talking about the impact on community members or patients and caregivers in their daily lives. I'm going to ask Telisha if she has any examples of that from our now included community. But before that, I'd love for you to hit upon some of those other skin conditions,
Sure.
Dr. Desai, that were on the slide. So we talked about atopic dermatitis, which is eczema.
Right. So
and I think a lot of us in the Black community, I mean, that's the clinical name for it, but eczema is more commonly what we would call it.
You're right.
But what about HS and prurigo nodularis? Can you talk a bit about those as well? And we'll go a little bit deeper.
So hidradenitis suppurativa, sounds like a spelling bee word, and it probably is. But and I'll be very honest. I think I went to. I think I had a great medical school, great training program. In fact, before I got into dermatology, I did ear, nose, and throat surgery. So kind of saw that side of things. But I'll tell you. And I'm not, and I was a very, very conscientious student. I wanted to learn everything. I wanted to make sure that, I did well. And I have to tell you, I had never heard of hidradenitis suppurativa probably until about 7-8 years ago. Okay. And that's embarrassing. I mean, not just for me, but just, and I would tell you that we can go across the United States and I'll, submit my PTO or what I'm supposed to do. I don't know the rules in my own clinic, but, go across the nation and let's ask doctors, hey, do you know what hidradenitis suppurativa is? Okay. And the answer is probably, you're going to be shocked. I would say it's going to be in the 20% range as far as who really knows what this is. And the reason I know that I'm right is because when I see patients that have this condition, they have usually seen about 5 or 6 or 7 other, not necessarily dermatologists, healthcare providers. And they said, well, it's a boil. It's an infection. It's what I'm eating. It's because I'm Black. I sat down. So some doctor told you that you're getting this because you're Black. I mean, that is the most absurd thing I've heard in my life. So again, you see how the systemic ignorance just keeps repeating itself and cycling. So I said, this has nothing to do with, with anything. Now, African Americans are, 6 or 7 times more prone to this condition. But what I'm trying to get at, this is not an infection. This is actually an autoimmune condition that is immune mediated. So you need, you don't need alcohol wipes or you don't need surgery to cut out the infection. You actually need probably most likely if it's severe enough or even moderately present, you probably need a biologic therapy which goes directly to the immune cells and attacks the condition from the immune system level, not from the superficial level. So with HS, that's the short name for doctors are just, they're misdiagnosing this day in and day out. African-American females more likely to, in my experience, have HS. And on average, I would say most of my patients have seen a healthcare provider of some sort, ER doctor, family practice, interns, whatever. They've seen 7 other doctors until they get, and again, it's not about me. They can go to my brother, people that really understand skin of color, and they say, no, you have HS or hidradenitis suppurativa, and it has nothing to do with cleanliness, has nothing to do with, whether you have brown skin or black skin or white skin. This is a autoimmune, immune mediated condition. Next, we have prurigo nodularis, PN for short. These are, this is where a patient gets these really firm, almost like bumps, almost like razor bumps in a sense, but they're intensely itchy. Okay. People cannot sleep. People have become, at least what I've experienced, even become suicidal because the itchiness is so bad. And this is yet another kind of condition that doctors, not dermatologists, but doctors and healthcare providers in general, they have all sorts of theories. Oh, it's because you're eating too much sugar. It's because you eat too much salt. It's because of this. No, this is, again, an immune mediated, the patient cannot help themselves. This is something that their immune system is doing. And again, if it's severe enough, we have to use medication that's going to attack this disease at the immune system level. So, we used to call them Picker's nodules, and we used to actually, back in the day, dermatologists would actually blame the patient, say, well, it's because you're picking your skin, and that's why you're getting it. They're picking their skin because it is so itchy. It is incredibly itchy that there's nothing else to do but to ease the, I don't know if anyone here has ever had an intense itch. It is awful. It is awful. In fact, I don't have a reference, I apologize, but going back to atopic dermatitis, so they rank different diseases like asthma, COPD, all sorts of things. But the first condition that really affects patients' mindset was cerebral palsy. Okay, it affects the patient, affects their family members. Do you know what number 2 was? Severe atopic dermatitis. Number 2. I mean, it beat out asthma. It beat out COPD. It beat out hyper. I mean, it's number 2. So, and the reason is whether you call it PN or atopic dermatitis or eczema is because of the itchiness. Okay, so that's what our aim should be as providers, is to really try to control that itch and listen to them, and look at and touch the skin, feel, palpate. You can't diagnose skin conditions when you're all the way in the corner of the room with your hands behind your back. So.
Thanks, Dr. Desai, for walking through those different skin conditions, and not just talking about, clinically how they might present, but the impact on quality of life. And I'm looking in the chat. There's a couple of things that jump out at me. Is number one, so many people in the chat who are like, yes, I know somebody who actually has HS. So it's really not as rare as folks may make it out to be, but look at who it is impacting, and perhaps that's why it's misdiagnosed. I mean, I know my best friend has HS, and it coexists with other autoimmune diseases as well. And the time it took for her to get a proper diagnosis was a very long time.
Right.
Telisha, I'm curious to hear, your perspective from, working with our Now Included community. Do they experience the same thing in terms of misdiagnosis or being told, untruths by their physicians who really don't know how to diagnose these skin conditions on them, and then also the impact on their quality of life?
Yes, most definitely. This diagnosis is major, across all of our therapeutic areas that we work in, but especially in the hair and skin health community. People have been dismissed, which is both, disheartening, and, it just adds to suffering, in terms of, how people feel and how they're valued. Right? Because, and I want to share just a little brief story from my own experience. When I was in undergrad, I had to go to the doctor. I was sick. And I went to the ER because I didn't have insurance at the time. And when I went there, and I grew up extremely poor, so I've never really had until I got older and understood what it was supposed to be, never really had, a really good experience at a doctor's office. And during this time, I was taking organic chemistry, and I had my chemistry book with me, right? Because I was studying. And so the guy came in, he didn't even look in my direction. He asked me what my symptoms were, was real dry, like I had expected. But then he looked and he saw my chemistry book, and his whole attitude changed. All of a sudden, I mattered. And that, he asked me questions. Like Dr. Desai said, instead of being in the corner, he was in my face, and he was interested in my case. And it was at that time that I really understood how the impact of understanding, everyone's value in terms of the healthcare that we receive. So, that's an experience that I've had, and I know that many others, especially in our hair and skin health community, have had. People with vitiligo mentioning that their doctors have told them that there's nothing they can do, which is absolutely not true. To Dr. Desai's point, people being blamed for their skin conditions, like it's something, related to cleanliness or, what they're eating. And again, as I mentioned, these things are very disheartening to people, right? I mean, it takes a lot, again, going back to this idea of, having the struggle pertaining to your skin in general, because we live in this country. But then again, now you're having, an issue with this, and you go to the doctor, and not only are you shunned because who you are, but, you're having a problem in addition to that, which exacerbates the entire situation. So again, for me, it's really important that we educate community members, let them know, that they're not alone, increase their awareness and education in terms of what questions to ask, what they should expect in terms of good healthcare. And, one of the things, Dr. Desai and I talk about a lot is educating healthcare professionals so that they understand, the value of every patient that comes, walks into their clinic, and also, what signs and symptoms to look for, because they are different, right? But they need to take the time and understand, that we are all part of the human family, and we all deserve adequate health care.
No, that's yeah. I mean, and to add to that, with that whole systemic ignorance and kind of the perpetuating cycle. I mean, do you know what the U.S. Public Health Service did from 1932 to 1972? So what is that? That's 40 years, 4 decades. You know what the U.S. Public Health Service did?
Yes, the Tuskegee. Well, I do.
Yes.
And a lot of us in the Black community,
Yeah, we know that one.
Thanks for stealing my thunder,
that,
Dr. Campbell. I mean, that that's fine. That's fine. I mean, you acted like you were on Jeopardy. I mean, you were arms raised. I mean, we're surprised. Okay, so it was a question to help educate. But anyway, long story short, this was one of the most unethical research studies. They basically tricked, I think, 600 African American individuals into saying that they're going to get free treatment, money, and all sorts of things. And even when we did have a treatment for syphilis, they just let these patients suffer with the condition. I mean, if you really read about it, there's books and books about it. It's I mean, it'll make you cringe. You'll make you cringe. I mean, it's an awful thing. However, the silver lining is sometimes, if there's something good can come out of it for a lot for the other population, then then at least we can at least kind of hope that that's it was worth it, perhaps. Okay, and that's not then, and not only mean that those poor individuals had to go through all that, but because of this debacle in humanity, really, that's where we get informed consent for any clinical study. It really kind of shaped and up a lot of things in the clinical research. There are rules now. There's informed consent. You had to tell the patient what maybe could happen, and full disclosure. So unfortunate again what happened, but because of that, changes had to be made, and they were made. So.
I appreciate you, Dr. Desai, for bringing that up, because that really lends to a lot of the mistrust that is experienced in the Black community towards the healthcare system, towards clinical research.
Right.
It's always very interesting to me that many of us in the Black community are very familiar with the Tuskegee syphilis experiment. So you ask that question, we're all like, yeah, Tuskegee, but a lot of non-Black folks don't know.
Oh, I know.
It's like, well, you've never heard of it before? What is often missing is that next piece that you mentioned, is what came of it, right? And so what are the guardrails and the things that are now in place to keep everybody safe when it comes to research?
Right.
And I want to stick a pin in that, because I want to go back to the clinical research piece and why it's important for the Black community to participate in clinical research, especially when it comes to skin conditions. But before we go there, I'd love for us to watch a video from one of our now included community members who is diagnosed with a skin condition. Telisha mentioned, our hair and skin health community. So we have these different, for those of you listening, these different sub-communities within our broader now included community that focus on different disease areas, and we call them circles. So we have a cancer circle, we have a chronic disease circle, we have several circles, and we have a hair and skin health circle. And so we have a community member, Dericha, I think that's how you pronounce her name, Dericha, who has prurigo nodularis. So that's one of the skin conditions Dr. Desai talked about. And she shared her story with us. And so we want to show a bit of her story before we talk a bit more about her experience and also the importance of clinical research. And we're unable to hear. So we'll get our technical issues squared away. while we wait, oh, no, there we go. Oh no, wait, we're still not able to hear unless, are you guys able to hear Telisha or Dr. Desai? If you drop in the chat, are you able to hear the video?
No.
We'll give it one more try and then we'll move on. We can always, all of our videos for Now Included are posted on our YouTube channel, so you can always check out the full videos on our YouTube channel. If we're not able to pull it up here, but we'll give it another go to see if we can pull up the sound. Okay. Well, while we're waiting to pull that up, yeah, we're still unable to hear it. And before we jump into the clinical research conversation, and I believe that part of what Desai talks about is some of the mental toll that having a diagnosis with prurigo nodularis, the mental toll that it took as well. So, Dr. Desai, Telisha, can you speak to that? Like, what are some of these other impacts that having such a diagnosis can have on patients?
Telisha, you first.
Yeah. So just kind of giving some feedback into Desai's story. She was diagnosed with prurigo nodularis in high school, I believe, and really had a terrible time with the itching, as Dr. Desai mentioned, as a major symptom of prurigo nodularis. She said that she used to scratch her skin with knives to try to get rid of the itch. That's how bad it was for her. And that, she went to several physicians and was told things like that it was bed bugs. So going back to this, the understanding of how, the racial undertones of our country really affect healthcare and how it affects people, right? She had a terrible time throughout her high school years. It would be 80 degrees outside and she would be wearing long sleeves because she was ashamed of, the bumps and things on her skin. So talk about mental toll, like, not belonging, not being valued, not being heard, completely dismissed. I mean, you name it. And just imagine in high school how difficult that is, on its own. And then, you're a Black female teen going through your high school years, and you have prurigo nodularis, on top of that, and you're itching out of your mind. I mean, just that's amazing in terms of the mental toll that it had on her. And kudos to her as an individual for sticking through and getting to the place where she was participating in a clinical trial and found something that works for her.
And I also want to mention, diagnosed with prurigo nodularis right after high school. In 2016 is when prurigo nodularis first appeared on my body. I was diagnosed with it, however, in 2018. There's a gap there because when I got it in 2016, no one knew what it was. I went to dermatologists from Miami to West Palm Beach to Tampa. I've heard bed bugs, I've heard eczema, I've heard everything you can think of, but except peeing. I finally got diagnosed because I joined like this little study and they were able to tell me what I have, which is peeing. That is my timeline on how I got diagnosed. But for the first 2 years, no one knew what it was. And at that point, I thought I was dying. Mind you, while all of this is going on, I'm like 17 years old, just finishing high school. And here I am thinking I'm about to start my prime years. I'm about to start adulting. Peeing had a horrible effect on my mental state. I was depressed. I started eating. I got overweight. My self-esteem was out the door. I kept telling my mom I'm ugly, I don't want to go anywhere, I look like a monster. I really did not. I spent those 2 years inside my room.
I stand corrected. It was right after high school that she was diagnosed. Yeah, but definitely, as you can tell, it had a profound effect on her quality of life.
Yeah, no, it's true. I mean, what all the things that she explained, and I think she did a really great job in explaining it so that it's impactful. And and even when the prurigo nodularis, let's say, because there are times where you may not constantly get itchy bumps. There might be a time where you have almost a reprieve or something, but you still have maybe hyperpigmentation or hypopigmentation. So you have all these spots everywhere. So imagine, I think it's hard enough to try to get a girlfriend or boyfriend at that age being quote unquote normal, but imagine having all these different pigmentary alterations, going to the grocery store and paying money. Like, I've heard patients say, well, the cashier didn't even want to take my money, wearing black, like these are black scrubs, if you have psoriasis or atopic dermatitis, you can have a lot of flaking and scaling. So you're just covered in this, so, a lot of us, and then then you have the other end of the spectrum, patients where they're like, hey doctor, this time I'm here because I have a little pimple right here, and I have to get out a magnifying glass, put on my special glasses with the magnifying glass, and what I don't, and and you just wonder in your head, like, God, you're worried about this little zit, and then there's people like Desai that's just been, that for 2 years, probably more, I would imagine, and again, you don't want to get this at any age, but you could, like Telisha said, this is like, these are your formative years. This is like, am I going to go to college? Am I going to get a job? And you're just worried and you're covering up and you're itching all the time, not sleeping. How are you going to perform? How are you going to exist? And I just feel terrible. And then doctors give them Zyrtec or Sage. And I don't know why the poor bed bug. I have a lot of sympathy for the poor bed bug. Cymix reticularis. This bed. If doctors don't know what something is, they're like, it's bed bugs. I promise you. You got a rash. Oh, I don't know what it is, but I think it's bed bugs. And they just and it's interesting because skin of color patients, especially African Americans, they seem to get more bed bugs than, and I put that in air quotes, by the way, than the other population. So there again, from real big, U.S., public health, clinical studies to even at the really granular level, you see that systemic ignorance, kind of pop its ugly head. So.
Absolutely. What jumped out to me from Dorisha's video, she said that she finally got a correct diagnosis through participation in a clinical study. So I would love to go back and talk about that. We talked a bit, Dr. Desai, about the Tuskegee syphilis experiment and how that, has bred a lot of mistrust in clinical research in the Black community. But there were also, positive, I won't say positive things that came from it, but guardrails and safety measures that are now in place because of what happened with the Tuskegee syphilis experiment, and that, keep people safe in clinical trials. Right. So from your perspective, why is it important for Black patients to consider participation in clinical research?
No, it's a great question. And again, I'm embarrassed to say that the medical community, not dermatology necessarily, but just the medical community, clinical studies have always been focused on, most of the medications that we know about, it's predominantly Caucasians, right? And again, we're human. We have a heart. We have 2 kidneys usually. We have, 2 lungs. I get all that. But there are subtle differences about bioavailability, about how, and you're a pharmacist, right? You know more about this than I do, and so I apologize if I say anything wrong, but it's just the bioavailability, the half-life. There's a lot of different things that can be a little different, and those small changes actually can have great effects, right? So now, and it's only certain companies. I wouldn't, because I do a lot of clinical research, have multiple clinical studies going on, even currently right now in the field of dermatology. But there's only a few companies that really stand out to me that really have in basically skin of color patients. It's just a dedicated skin of color trial. Again, let's go. Let me submit my PTO. We'll go across the nation.
Oh, it sounds like,
Are they dedicated to skin of color? And the answer is probably no. So
we had a little bit of pausing there from you, Dr. Desai, but it sounds like you were saying that that there are some research sponsors, but not a lot, who are dedicating, some of their clinical studies to focusing on skin of color, which is important because, depending on the type of drug, whether it be something that we ingest, or even if you put it on your skin to address these skin conditions, the bioavailability or how well the drugs work can be different because there are differences amongst us as people. So that's why it's important for us to participate. Telisha,
when I do try to, if I have a subject that's African American and I want them, I say, hey, I think you'd be a good candidate for this trial. Not everyone is going to be a good candidate. I mean, I really have to sit down, talk to them, really make them feel, and I think because I'm also a skin of color doctor or physician, I think there's a little bit more trust, not completely, because I think, they might have heard their grandmother or grandfather talk about, because those are the kind of stories that get passed down. And so, look, this is completely different. But it does, but I will tell you that in that skin of color clinical trial, now that was open to, Hispanics, Latin community, Middle Eastern, Indian, I would say out of, the handful of subjects I got, the minority of them were African American. They're still hesitant to enroll. So,
but not only are they hesitant to enroll, but when it comes to so part of my job now is to help to increase representation in clinical trials, and I work with community members as well as clinical trial sites, and we have this understanding in our country about what it means to be in a minority. And there's the exotic minorities, right? If you want Asians and Arabs, and right, and then there's Black people, and right, so it's like on that bottom rung almost. Right. So and I find that all the time when I'm talking to clinical trial sites, and we say, is your site diverse? And they're like, oh yes, we have Hispanics are kind of moving up the chain a little bit. Right. But they'll talk about, again, Asians and someone from Europe, or what I mean, like, but then when you start to ask about Black participation, it is something different. And again, just goes back to the history of our country. Until we really are able to address those issues, it's going to be difficult to really have adequate health care within our systems.
But Telisha, I have a very important question for you. Am I considered an exotic minority or no?
I think so. Most definitely.
But no, you're absolutely right. I mean, that it's so. I mean, to kind of tie it all together, not only are African American patients treated inadequately, they may not get the access to care, but also even in the clinical trials situation or setting, there's that. So it permeates the whole span of the and whether we like it or not, pharmaceutical companies, these are billion with the B, okay, $1 billion. I mean, they kind of run the world in a sense, right? So if we're not studying how these medicines work in African American people or whatnot, I mean, then we're it's so we got to keep fighting the good fight, and that's right. So.
Yeah, and I wanted to bring up as well, through our engagement, through Now Included's engagement with the community, we always ask community members if they would be willing to participate in trials. And 50% of people are willing to participate. 75%, however, are never asked.
Right.
Right. And so that's it's something very important to point out, right? It's not that, even with the Tuskegee experiment, as well as, Henrietta Lacks case that just got, just went through the course last year, I believe, right? There are still inequities, that are present. But even with that, a lot of Black people understand the importance of participating in clinical research. But again, if they're not being asked, and if they don't even know that they, exist, therein lies the problem.
And I think that's how we got connected, right, Telisha? Because of the clinical trial that I was part of, and it was a skin of color clinical trial, and that's how. Okay, so yeah,
sort of, but yeah.
Don't let the truth get away with a good story, So.
No, but I thank you both for highlighting that the disparity doesn't just exist because because there is this mistrust. We're in the community all the time, and like Telisha said, we hear from people who know what clinical trials are, and I especially think since COVID-19, people become more familiar with at least the terminology around clinical research and would actually be interested in participating, but they're never asked. So that goes back to the education part on the side of the healthcare professional to say, what bias exists from your end where you're not asking people to participate if they maybe don't look like what you would expect or want your clinical trial participants to look like in your study or meet this certain criteria that you have in your mind without fairly asking all people who are coming through your office who might be eligible. So that's a great call out. I know we have just a few more minutes, so I'd love to see if there are any questions from our amazing audience members. Feel free to drop them in the chat. And while we are waiting to see if we have any questions, Dr. Desai and Telisha would love to ask you, what are some strategies and best practices that you would recommend to individuals in the Black community for maintaining great skin health as much as possible, and also any resources that might be available for those on the call who want to learn more? Dr. Desai.
I always have to go. Thank you.
What are some recommendations? What would you tell me?
It cut out for like a few seconds. So I'm sorry. Recommendations for good
for people with Black skin to maintain good skin health.
Okay. First and foremost, believe it or not, and I may get, hopefully no one says anything bad about me in the chat room or whatever. Gotta wear sunblock or sunscreen. You may think that you don't need it. You have to wear it. And I'll tell you why. First of all, it's going to prevent any kind of skin cancer or help prevent it. But you may argue with me and debate with me and say, well, I'm not really worried about that because I have, my skin type is darker and I'm not too worried about that. But let's forget about skin cancer. The sun really ages anybody, right? That's how you get hyperpigmentation. That's how you can get premature wrinkling. That you can just get all these different things. So if you want to look your best and as from a skin perspective, you have to wear some. That is the best cosmetic cream that I could recommend. Okay. Now there are certain brands that I like. I like this one brand called Isden because Isden is a sunblock, but it also has these botanical ingredients, if you will, that reverses any kind of sun damage you might have had. There's another one called Extreme Protect. That's a sunblock that does really well as well. If you ever want to know the names again, let me know. So anyway, so that's kind of the foundation. That's the centerpiece of your skincare. Then it just kind of depends on, do you have dry skin? Do you have oily skin? In general, if someone asks, okay, aside from sunblock or sunscreen, I'm concerned about anti-aging or wrinkles. Use a good prescription retinoid. Okay, I'm not talking about the stuff where you go in the mall and these beautiful women and men, wave something at you and you get a free purse or a free bag. That molecule is different. Okay, so I'm talking about prescription strength retinoid. Use it at nighttime. It can make you more sun sensitive. Going back to the sunblock, that's why you have to use it. But that is a very just that 1-2 punch. Sunblock, retinoid. That will help probably 80% of people looking to rejuvenate their skin and just make it look, maybe younger, more youthful looking. And that's 2 things. That's not 20 things. You don't need 15 or 20 things. You don't need a 11 a.m. cream and a 5 p.m. cream, right? You just that's probably you just need those are foundational elements that you need.
Such great advice. We do have a question. So we heard sunscreen and a good prescription retinoid. There was a question in the chat around ingredients we should avoid if we have darker skin. Any suggestions there?
So I think we talked about benzoyl peroxide. Avoid it like the plague.
Okay.
It's just not good for us. God, what is that one? Acne. They're bazillionaires now. You can get it at the airport. Proactive. All Proactive is. I mean, it's they charge whatever they charge, but you can get like 1,000-pound bag of benzoyl peroxide for like $5.99. Okay, it's extremely cheap, but they package it. But benzoyl peroxide in our skin type does not work. It becomes an irritant. Okay, you get and guess what happens when you get irritation, which is inflammation? You might pick, you might scratch. Let's say you don't even do that, but then your skin will respond by becoming more hyperpigmented. So what you initially go in for, let's say for your acne needs or whatever, you get prescribed benzoyl peroxide. Now you have another set of problems because of the benzoyl peroxide, and it just becomes a mess. So avoid benzoyl peroxide. I personally would. This is probably a very strong statement, but I would personally avoid sunscreens. Okay, there's a difference between sunscreens and sunblock. So I just, a couple minutes ago, I said, well, you better wear sunscreen, sunblock. What I really mean is you should wear sunblock. Sunscreens, the way sunscreens work is it's a screen. It still allows ultraviolet radiation to go through. A sunblock is a blockade, right? So with sunscreens, the way it works is you put it on your skin, you put it on your face, and when you go out in the sun, the ultraviolet radiation, it causes a chemical reaction, and then and that's how you get the protective mechanism. I'm not too sure, as I do more research and more reading, that chemical reaction can produce some other carcinogenic components. So in my opinion, stick with zinc. That's a sunblock. It's inert. Zinc is a beautiful molecule. It will not hurt you. It will only help you. It won't cause, there's no chemical reaction that has to occur. You put it on and it's blocking the sun rays. So.
Ooh, you teaching us some stuff, Dr. Desai.
Oh yeah, let's go.
We gotta
do this again.
Sunscreen versus sunblock. That is and the zinc. Yes, that's
Zinc.
There. A lot of folks didn't know that there was that difference. So thank you for highlighting that and what the differences are and what our skin reactions could be with one versus the other. We only have about 5 minutes. We have one other question, and then I'd love for Telisha to talk about some of the resources that are available. So our last question around OTC solutions which it's over-the-counter solutions for hyperpigmentation. Are there any?
I don't know this Devon Adams, but he's asked 7 questions already.
Devin,
I'm sorry. So we, anyway, I'm kidding. No, so there are some good over-the-counter creams for hyperpigmentation. The problem is that you have to know where the hyperpigmentation lives. If it's more superficial, then yes, some of the stuff that you can get over the counter, there's a hydroquinone, I think 2%. If it's very superficial, it can probably take care of that. Okay. But usually most hyperpigmentation is superficial, but it's also kind of in the dermis, which is kind of the second layer of the skin. That's when you need the prescription strength, stuff to do it. I honestly, it's so easy to get a prescription nowadays, good or bad. I mean, we can right now, we can go get a prescription of Ozempic. I don't even have diabetes, we can just get it. But so the prescription strength I like is Triluma. Triluma is a great cream for hyperpigmentation. It has 3 components. It has that retinoid, and it has the hydroquinone, and then it has a little steroid to help with the inflammation. And and you use it for about 4 to 6 weeks on, let's say, an area that you have. Works beautiful. You don't want to use it more than that. You want to use it less. Works great. So, Mr. Adams, get some Triluma.
Thank you. That's great. That's good information. Triluma. So everybody writing that down in the chat. Telisha, can you wrap us up by talking about some of the resources that are available and maybe a call to action for those who are joining us online?
Most definitely. Join Now Included so that you can avail of all the information that we have on hair and skin health. I was going to mention earlier that Darisha's full story is on our Now Included platform, so you can hear all about her experiences and other people with other skin diseases like vitiligo and HS. But it's really important, to hear from other people and from their experiences, right? That's how we learn, I think, the most in terms of these issues. There's also a video with Dr. Desai's comments on Derisha's story. So again, there's a wealth of information that is found on the Hair and Skin Health Circle and Now Included. And this is information that is tailored for us by us. These are trusted resources, so that when you go to the doctor and you have to advocate for yourself, you know what you're talking about, right? All about empowerment. Right. So join up for Now Included, avail of the information that we have so that we can have, have the best hair and skin health we can. Right. We know the adage, black don't crack. However, it does if you don't take care of it. Right. So know what you got to do. Sign up for Now Included membership so you can, learn more about hair and skin health. And that's what I had to say. Yeah.
Well, thank you both, Dr. Desai and Telisha. Any last parting words in our last minute?
Yeah, so I love Tupac. I grew up with him, and I just have to quote him. Look, you have got to make a change, is what he says. And we as a people have got to make a change. So that's why we're doing this. That's why we have Now Included. If you did not, I talk a lot, talk fast. If there's something you didn't understand, contact me or go through the proper channels. More than happy to answer or help anybody out. So this is all about, when I took that oath as a physician, it included is advocacy. And I'm trying to honor that oath. So thank you for having me. You guys are wonderful. And I really, really enjoyed myself. Thank you.
Well, thank you for joining us. And with that Tupac quote, we're going to drop the mic. We appreciate all of our Now Included members who also joined. If you have any additional questions or would like to follow up with us, you can email us at hello@nowincluded. Don't forget to join the community, and we will see you next time. Thanks, everyone.
Thank you.
Bye.
Bye.